Now our panel will take a deep dive into some solutions to bring down prescription drug prices. I am now joined by Priti Krishtel, a health justice lawyer and co-founder and co-executive director of I-MAK. I-MAK is a nonprofit that focuses on improving global access to vaccines and medicines by challenging drug patent monopolies. Alex Brill, an economist and founder and CEO of Matrix Global Advisors, an economic consulting firm. And Lauren Aronson, the executive director of the Campaign for Sustainable Drug Pricing. The campaign represents all parties in the drug pricing debate, minus the pharmaceutical voice. Welcome to y'all. Priti, let me start with you. What do you believe is the problem with drug patents in a way that I would understand and from 30,000 feet and our audience would understand? Because it's complicated, as you know.
Sure. A patent is supposed to be a time-limited monopoly where if a company invents a drug and they file for a patent, they get 20 years of exclusivity. But unfortunately, what we've been seeing lately is that companies are filing for dozens or even hundreds of patents to extend their monopoly period in order to keep their revenues, and that's blocking competition from the market.
And what do you think should be done?
So what we're basically seeing right now is that there are 7 out of 10 of the top selling drugs right now are supposed to go off patent in this decade. Mm-hmm. So what we're seeing is that the companies are just trying to figure out, how do I hold on to my revenue? And the answer that they found is to file more and more patents to build a thicket and block their competitors. We think that Congress really needs to tighten up the system to make sure that type of patenting behavior doesn't happen anymore. It starts with the agencies. We think that Congress can do a lot more to provide oversight of the agencies, bring more scrutiny to how examination is happening. Examination is basically the process where patent applications are reviewed before they're granted. But ultimately, Congress is going to have to tighten up the rules of what is worthy of a patent.
Lauren, can you tell me just a little bit about what your group does in reducing drug prices for consumers, kind of on a daily, short-term, long-term basis?
Sure. So our members represent, as you noted, everyone in the supply chain with the exception of the pharmaceutical manufacturers. So we represent physicians, nurses, seniors, patients, health plans, employers, and pharmacy benefit companies. So what unites our members, though, is really this focus on the role that manufacturers play in setting the price. And so when we're doing our advocacy, we are focusing on market-based solutions to bring down the cost of prescription drugs for patients and for consumers across the country. So we are focusing both on short-term issues and long-term issues as well. And so when we think about patent abuses, from our perspective, to Priti's point, really getting to making sure there are lower cost alternatives on the market is really the I-Ching of what we're trying to achieve here. And so I think in the short term, there's a lot that the administration is doing between coordination between the Patent Trade Office and the FDA, as well as Congress. We've seen some bipartisan bills pass through the Senate Judiciary Committee recently to try to address these patent abuses that Priti noted.
Lauren, you've worked for CMS, you've worked for the Ways and Means Committee and the White House. So that's a lot of perspectives working on healthcare. What did you learn, and anything surprise you of the difficulty? It's never easy getting anything done in healthcare.
Wow, great question. I will, having worked in the Affordable Care Act when I was in the White House, and then now working on drug pricing, they're both very paramount. But I think my takeaway really is that the voice of patients, I think, is really critical in getting something achieved. And what we've seen is that the outrage over prescription drug pricing over the last several years has really forced Congress to act on something where, many people have thought for a very long time that the pharmaceutical manufacturers have really controlled Congress. And what we showed through the last several years is that you can make change. It takes a long time, and you can't let perfect be the enemy of good. But with every bill that passes, we are incrementally making change and helping bring down the cost of prescription drugs.
Alex, you and I, late last year, we talked about your experience in creating, which was at the time the biggest expansion of Medicare since its inception, Part D. You talked about something that was not easy to get done 20 years ago. A 15-minute vote became a 3-hour vote in the House, and it did help, I think, President Bush's reelection chances. He ended up winning, but they had to pass the bill, I think, in order for him to win. What were your takeaways from that legislation, which you know was controversial, but it wasn't as costly as some, including CBO, said?
Yeah, that's a great question. Thanks, Bob. Well, I mean, I'll go back to something that Lauren mentioned a moment ago, which is the patient perspective, or the consumer perspective, or the voter perspective. I think a lot of what was motivating the decision to bring prescription drug benefit into Medicare, to create Medicare Part D, was a recognition by policymakers, by lawmakers, Democrats and Republicans, that there was a benefit that was, the public was deserving and needing of here. Then the question became the how, right? And how will that benefit be structured? Who will make the decisions? Who will structure that benefit? Who will set the prices? That was a relatively partisan effort, not entirely. Republicans were committed to harnessing market power, market forces, market interests, and driving competition and creating that benefit and harnessing the private sector in delivering Medicare Part D. You talked about the cost of that. The cost of that at the time of the development of legislation was hard to know because we had never done this before. And so you're doing something for the first time. It's hard to know how much it's going to cost. What we've experienced afterwards is that in large part, due to the positive role of generics and competition in the marketplace, the overall cost turned out to be less than what was originally anticipated.
Alex, you mentioned market, and what is the biosimilar market? How is it evolving in the coming years, you think?
Yeah, I mean, the biosimilar market is a great example of bringing prices down in the prescription drug market overall. And there's really two conversations that are happening together here. One is this question about what can we do to bring down drug prices, and the other is what can competition do to bring down drug prices. Senator Smith talked a lot about competition, and she talked a lot about other strategies that are not competition based to address drug prices or out-of-pocket costs for consumers. And all of those are tools and are strategies. The government can negotiate prices, the government can set prices, or the market can work to drive this competition. Biosimilars are a market-based framework. The government plays a role here. They're approving these products. They're facilitating this pathway. But biologic drugs are generally the most expensive drugs that we have. They can be incredibly expensive. That's in part because they're very hard to develop. It's in part because the manufacturers have monopolies and they're demanding high prices. When we create a competitive environment for a biosimilar, then we get the natural market-based competition forces, and what we see is prices fall. Prices fall not only for the biosimilar who comes into the market and sets their price lower than the monopolists, but also the monopolists want to stay in the market themselves, and they're forced to bring down prices. Just as Priti said earlier, the companies are interested in maximizing their own revenue. That's not a bad thing. That's just a fact. Competition makes that more difficult for them, and biosimilars is a good example.
Priti, the pharmaceutical industry makes a case if you're going to clamp down too much, you're going to pass what they say are pricing controls, and when you're going to hurt R&D, that's going to hurt patients in the long run. What do you think of that argument?
Yeah, I don't think anybody is talking about clamping down and stifling the industry's capacity to deliver for Americans. What we're talking about is in cases where there's clearly gaming of the system happening, those sort of end stage abuses. Now, I mentioned that 7 out of 10 of America's top selling drugs are due to go off patent this decade. 5 of those are biologics. And if you look at these top selling drugs, like, drugs for arthritis, for example, or for cancer, we're seeing in specific cases like Humira, like Enbrel, that Europeans are getting these drugs more affordably years earlier. And I think we have to ask the question of why. And that's where our research has shown that they're filing and getting many, many times more patents here than they are in Europe. They're asserting more of those patents in litigation here than they are in Europe. a lot of tactics that we allow here in the marketplace that ultimately are hurting Americans. And we're just asking for a right sizing of the system. Let's just correct for some of those rules to make sure our market can stay healthy and competitive.
Lauren, you mentioned that you were in the White House as the Affordable Care Act was getting through, and as you remember, and a lot of viewers remember, there was a deal struck with the pharmaceutical industry to get on board. Can you talk about the kind of the delicate dance of striking deals? Because in order to move controversial legislation, which almost all of healthcare is, you've got to strike agreements in order to advance legislation. And what do you think policymakers can learn from that, as you know, very exhausting experience?
Yeah, I mean, I'd say a couple of things. I mean, one, anytime you're moving a major piece of legislation, particularly like the Affordable Care Act, every stakeholder in the healthcare industry, not just the pharmaceutical industry, had reductions in the law. Hospitals had reductions, health plans did, and the pharmaceutical manufacturers did it too. And the pharmaceutical manufacturer element of it was pretty significant. I mean, there were a number of policies that were included in the ACA that really, helped to bring down the cost of prescription drugs and reduce the federal government's liability. I think at the end of the day, when you're trying to move major pieces of legislation, you always need to balance kind of what the goals are. And at that point, the goals aligned. At that point, the industry wanted to help support coverage and coverage broadly in the private market, and also recognize that they were part of the solution. It's unfortunate, though, that since the ACA passed, the industry has really taken a much different turn and are no longer part of the solution. They are now pointing fingers at everyone else in the supply chain.
Alex, as far as where healthcare has gone, the Congress now is not going to be tackling, both Republicans and Democrats agree, not going to be tackling entitlements, including Medicare reform. But also talking to David Schweikert earlier in the program, Medicare is going bankrupt, Social Security is not as bad, but at some point, this is going to happen. Are you optimistic that the parties, which did get together in 1990s to change Medicare significantly as a bipartisan bill, and that was basically struck by Newt Gingrich and Bill Clinton, are those days even possible anymore?
Well, the near-term rhetoric from both parties doesn't give me a lot of hope or optimism. We're hearing from both parties this notion that Medicare and Social Security is quote unquote off the table. It strikes me as odd, to be honest. Key provisions of the Inflation Reduction Act will reduce Medicare outlays. Those seem like Medicare provisions to me. Seems to me should be a strong desire to say to constituents, to say to patients, we're going to bring down your healthcare costs, and for those constituents and patients who are seniors, that seems to me to be touching Medicare. So the rhetoric is a little bit confusing to me, but the headlines are certainly that in the near term, those policies seem to be off the table. Ultimately, Congress will be forced to address these issues. These are not choices. This will become a necessity for all of our entitlement programs, Social Security and Medicare and others. They are on unsustainable paths, and structural changes will be required. To some extent, those changes could be implemented over time and could capture the power and forces of markets to drive competition to bring down lower prices, or Congress could choose to wait and be forced to make more painful choices in shorter periods of time. I don't know. It doesn't seem like they're going to make the right choice in the near term, but there's always hope.
Mm-hmm. Lauren, can you describe patent thickets? That's a complicated issue, but what's the role of patent thickets as far as reducing prescription drug prices?
Sure. So when and Priti mentioned this a little bit earlier, but you have a situation where a drug comes to market, they get their 20 years of approval. And then from there, what you're seeing is that manufacturers then basically create what's sort of like a patent fortress where they file multiple patents. In the case of Humira, I believe it's like 247 patents that were then filed on one specific drug. And they may be for things like small modifications such as a color change or a formulation change. You have a lot of duplicative patents that are done too, where they may say it's no longer 5 days, but it's 7 days, and that then restarts the patent clock. And so every time that you want to have a generic or a biosimilar then try to bring a lower cost alternative to market, they have to then go and challenge every single one of those patents. So patent thicketing, or sort of like a patent fortress, is basically a way for the brand name manufacturers just to protect their market share, and it really comes as a massive detriment to consumers. Free Up and Ovik Roy and his organization did a study last year that found patients paid over $5 billion more than they needed to out of pocket just because of things like patent abuses. And so as we're thinking about the impact on consumers, when patent thickets are formed to prevent lower cost alternatives from coming to market, that has a real impact on patients and on taxpayers.
Priti, as far as the Biden administration and prior administrations, when they've struggled to get legislation through Congress and to the president's desk, they tackle problems administratively through regulation. We've seen that with climate change, student loan issues, which is now before the Supreme Court, was done administratively. What would you like to see? I haven't heard a lot about what the Biden administration could do in a big picture that doesn't have to get through Congress, because as you know, we're in divided government right now, and it's going to be very difficult to get anything on healthcare, at least anything big, done in this Congress.
So this administration took an important step early on through the executive order for competition, specifically naming the patent system as a lever that needs to get addressed in order to promote competition. And under that executive order, and this is pretty historic, I know these technical fixes can also seem a little abstract, but it is pretty historic that under this administration and this executive order, the U.S. Patent Office and the U.S. FDA are working together in a more concerted way for the first time. And together they have the opportunity to really understand where in the rules, where in the system are patents slipping through the cracks that are actually delaying competition to market and hurting patients and families. So I think this is an important first step that the administration has taken. It is a pretty neutral change, but one that I hope will survive through administration so that these agencies that are tasked with overseeing different aspects of medicines will keep working together to raise the bar of what is worthy of a patent.
Lauren, let's take it down to the consumer level. When just kind of a simple question, but an important one, and I want to get to this because this is kind of the crux of the issue, is that when you have high prescription drug prices, how does that affect society? How does that affect everyday Americans on if they can't afford prescription drug prices? What can they do?
Right. I mean, it's a great question, Bob, and it is the reason why we've been having this debate for so long. We've seen, when drugs came to market in the late 80s to massive public outcry, it was around $8,000 or $9,000. And now we're seeing new drugs come to market that have, millions of dollars. And we all want new innovative drugs to come to market. And we need to balance that innovation with affordability. But you're absolutely right. If, with all these rising drug prices, families are forced to choose between groceries, elements of paying for childcare, education. And so it has a real impact. I think Congress has done a lot here to move the ball forward. And so has the administration, to Priti's point, but obviously more needs to be done. But for, a patient, when you're looking at, you're at the pharmacy counter, it is a real challenge when you're seeing what manufacturers are charging.
A lot of people say, we would never have the healthcare system we have now, which is employer-based. And Alex, I know your former boss, Bill Thomas, chairman of the Ways and Means Committee, kind of thought about decoupling them, but that was very difficult to do, and he knew that. We're talking a lot about the role of government, but what about the role of non-government? Whether, the healthcare system is dealing with stakeholders. A lot of them point the fingers at one another, saying it's not my fault, it's their fault. But outside of government, what do you think outside stakeholders could do to get to the point where there can be some agreement, because, as we discussed earlier, the healthcare system is not sustainable as it is right now, and there are going to have to be radical changes, or at least fundamental changes, maybe not effective tomorrow, but effective down the road.
Yeah, I think the role of non-government organizations, entities, employers, individuals, stakeholders is really critical here. I think one of the things that makes this difficult is that the right answer is not in either corner of the extreme, right? What we're trying to do is we're trying to balance multiple objectives. We're trying to preserve a market where innovative drug companies want to and can and are rewarded for their innovation, right? We want to have that. We want to have the new drugs that we have. And we also want to balance that against a desire to make sure that those products are accessible and are available. Now, obviously, the manufacturers themselves also want their products to be accessible. They can't make any revenues if they can't find customers for their products. But we need to find a way for that accessibility to maximize the benefit for the market as a whole, not the benefit only for the patent holders and the monopolists. And that's where this challenge and this balancing act comes to play. And it's where I think there's an opportunity for competition to help create that balance, right? And so we have a framework, broadly speaking, and Prita is exactly right. We're not talking about ending the patent system or something like that. We need to protect the patent system, I would say. But we need to think about the abuses, about the unintended consequences, and those strategies that are being deployed that are hindering competition and thereby limiting a really important public benefit, the benefits that accrue from competition, the benefits that accrue from multiple generics entering the market and driving prices way down, the benefits that accrue from multiple biosimilars entering the market. And then the last thing I would say is, yes, there are really high headline prices for a number of drugs, and there are individuals who are really stuck and struck by the cost that their own out-of-pocket pays. Individuals who are uninsured or underinsured in certain circumstances. We also need to keep our eyes on the bigger, broader picture about healthcare spending generally, recognizing that the majority of dollars that are being spent in healthcare are not pharmaceutical dollars, right? They're dollars that are going in other parts of the healthcare system. 10, 11, 12% of healthcare spending is drug spending. We should think about promoting competition in that market. We should also think about promoting competition in the rest of the healthcare system, and that has to do with other providers and other.
Well, we are out of time. We packed a lot in that half an hour. I want to thank our panel. Thank you, Priti Krishtel, Alex Brill, and Lauren Aronson for joining us today.
Pleasure.
And that brings us to the end of our program. A big thank you to PCMA, the Pharmaceutical Care Management Association, and to all of you for watching. For those who missed any of these conversations this morning, we will have the video up from the event on our website, thehill.com, shortly. I'm Bob Cusack. Have a great rest of your day.